Professor Sridhar, hi, how are you today?
Hi, thank you for having me.
And well, thank you for your time. It's really a real honor to have you with us today.
That's great. And I'm looking forward to our conversation.
Lovely, thank you. Well, Doctor, you are known globally for your important work in public health, um, and for helping us to understand how politics and social factors actually shape health outcomes. So, uh, actually, you have been at the forefront of discussions around COVID-19 and global governance through the last years. But before we dive into those topics, we would like to know more about you. Uh, I wonder if you can share with us who is Dr. Devi Sridhar and who is beyond that academic and public role that you are playing in this moment.
Yeah, so I guess I'll start where I'm from. So I grew up in Miami, so quite close actually to Latin America, and went to the University of Miami. My parents had immigrated there from India, and went there, and I studied medicine when I was at the University of Miami. But I got very interested in the social and cultural and political aspects of health. So issues around, for example, if you look at clean water or clean air or health systems. So I realized I was more interested in prevention than I was actually in what you might call classic medicine. So I was lucky to get a scholarship to go to England. And when I was there, I started to study more, you could say, the wider aspects of health. I decided to do my PhD. So I did that with fieldwork out in India, trying to understand child malnutrition, which is very tightly linked to infectious diseases. So you start to understand actually the wider health situation for people living in low income settings. And then since then, I've just kind of picked up different projects. I was in Oxford for a while, but I've kind of very tied, still visiting faculty at University of Miami, based in University of Edinburgh. But during the pandemic and even till now, I work with governments across the world on health issues. So yeah, it gives you an idea of my background and where I'm at. And I guess what drives it is the idea that we are collectively pretty much the same. We might be in different countries, we might speak different languages. We face very similar health issues. And so we must learn across countries. And that's kind of the essence that I tried to bring during the pandemic and what I try to do now with other health issues.
Right, right. Well, thank you for sharing this part of your story with us. You have many books so far, and perhaps in your writing, actually, we would like you have like how health decisions are often influenced more by politics than science per se. So, how did that reality become clear to you during the COVID-19 pandemic?
Well, I guess the COVID-19 pandemic was unlike anything we'd ever seen before. I mean, the closest thing was the 1918, flu pandemic. And back then, we didn't have the same communication, the same scientific knowledge to actually work together globally to find solutions to the crisis. And I think there, what was interesting is the scientific side, where there were questions around immunity, there are questions around health system capacity, there are questions around hospitalization rates. Those are scientific questions. And then the political questions are, what do you do about it? What is the policies you put in place? What are the trade-offs? How do you communicate them? How do you organize a public health response that's accepted by the people that you have and explain it? How do you change with changing science? When we got vaccinations, the message changed, right? It became, you might get COVID, but you want to be vaccinated first. And so I think there you really saw the scientific side, very important. So obviously we need facts, we need data, we need analysis. We need medical, products like the antivirals, vaccines, diagnostics. But equally important was the policy and how you actually manage it and bring those together. And I think every country in some way faced the same questions and had the same access to the same information and the same data. But the question was political system. How do you respond to it? How do you actually make that decision within your country? And that I think is what is interesting and what I tried to bring out in one of my books, looking at why did so many countries respond so differently to a very similar disease.
Right. Well, now speaking of governance, in this book that you have, the Governing Global Health, You actually analyze the roles played by institutions like the World Health Organization and the Gates Foundation, for example, just to mention two. But with those lessons, what reforms do you think are still urgently needed today?
Well, I think one is we have a very weak World Health Organization. We know the US government, especially under the Trump administration, have withdrawn and don't really want to support a UN multilateral system. We have, bilateral relationships, that is countries like China and India wanting to more control kind of their engagement in health on their terms. And so I think right now we're very weak multilaterally in terms of cooperation across countries. And so there are real challenges there. The other challenge that I guess we have seen become a real crisis for these organizations is they were propped up by a few funders. It was the US government, the UK government, and the Gates Foundation, which were responsible for almost 2/3 of the growth of their budget over the past 20 years. And so when you have a new administration come in that suddenly says, I'm going to pull back, that is a real crisis for the agency. This is why the WHO has had to cut staff, cut their programs, reorganize, because of such heavy dependency on a few donors. And that's one of the things we look at is the financing model. What we really should have is it equally shared across the world. So if one country pulls, it doesn't collapse because there are enough other countries there. But I guess with the growth in funding, it largely came from a few places. There's also, Gates Foundation, so influential, and it's really positive if you think of what he's doing compared to other tech billionaires who aren't putting that money into health. But there are also consequences to having, a foundation run very tightly by Bill Gates and his father, and his Melinda as well, his ex-wife. And what does that actually mean in terms of the priorities being set, in terms of the programs being implemented, in terms of accountability? And so we try to look at some of these questions for how global health internationally is organized, and explain how these agencies work. I think there is a lot of now misinformation around, the World Health Organization caused lockdowns, or they forced, they were worked with China to cover up the origins. It doesn't really understand how the agency works. It can't actually tell countries to do anything. It can't go into countries uninvited. It's a club for countries to come together and work together. So we try to explain how it actually works in the book. How is it financed? Some of the challenges, just so people understand the facts about these agencies, why they were set up, how they work, and some of the governance problems they might face in the future.
Right. Well, I have a feeling that also diplomacy plays a really key role in here,
Yeah.
right? In particular, perhaps now with raising inequalities, the geopolitical tensions that we have today. So, focusing on today, how do you see the role of diplomacy evolving in global health?
Yeah, diplomacy is very, very tricky because it means that you have to find common ground. Even if you disagree on things, you have to find ways to work together. So during the pandemic, I think the challenge for the WHO was working with China. They needed access to China. They needed access from the government to be able to know what was the outbreak, what is the disease, what is the risk profile, what is the epidemiology. And the Chinese government was very cagey. They didn't want to share this. And every week or every day they didn't share this, the virus is spreading and other countries are dark. They have no idea in the sense of they're in the dark. We don't know what's going to happen. So there, the diplomacy was that they were very publicly positive about China, saying the Chinese government is doing such a good job in order to facilitate access so that the Chinese government would let them come in. So they sent a mission in February. And when they got back, the head of the mission, which was Bruce Aylward, did a briefing. And he had a lot of information, really useful information in February about the risk profile, how it spreads, countermeasures, hospitalization rates. And so you can focus on, wow, why did they praise the Chinese government? The Chinese government covered this up. They didn't share information. They were slow. Or you can say that's diplomacy. They had to praise the Chinese government to get the access, to get the information, to be able to let other countries know. And that was the price they had to pay. And that's diplomacy. And so I think that's where, just to give you an example of diplomacy, that you see that sometimes things can't be seen in isolation. You have to look at the whole picture of what is actually happening with the government. And now we're seeing similar things with the US government. where we know many things the US government doing are not good for public health, like the push against vaccination. But the WHO cannot come out and say that because that's not diplomacy. They have to work behind the scenes to say, okay, where can we find common ground? Can we find common ground on at least childhood vaccinations? Can we find common ground on this area? Which is maybe not what activists or civil society want to hear, because advocacy is about a strong position and you come out and make your point. But these international agencies have to be diplomatic. They have to actually work closely with governments, which means to get access to maintain that kind of cooperation and flow of information, you sometimes have to compromise in other areas. So hard for academics, hard for civil society, but that's how these agencies work.
Thank you for sharing this idea. And I think it's really important in this moment. Well, all the time, but it's quite sensitive now, right? And well, in your book Preventable, for example, I was thinking in this book, you point out that many of the deaths related to the pandemic could have been avoided. And now, of course, we have strong evidence on that, right? It's something that we already know in this moment. But looking back, I was wondering, after reading this part of the book, what is the most important lesson that governments missed during the pandemic? Now that we can have all the elements to actually review the past pandemic of COVID-19.
Well, I think the first one was they didn't have faith in science, some governments. I think there wasn't the belief there would be a vaccination or antivirals or any kind of medical products to be able to save lives quick enough. So I think if every government had known at the start, you will have a vaccine within a year, there would have been a real argument for delaying infections, saying contain it, try to keep cases as low as possible, try to avoid the spread until you can vaccinate. But I think there was real cynicism over could we have a vaccine? Can we have antivirals? So some governments just let it spread because they didn't know what else to do in the situation. So I think lessons looking ahead to the future, I think many governments will approach a future pandemic differently. I think they will say, when are the vaccines coming? How fast can we do them? Are there going to be antivirals? And maybe try to contain spread rather than just letting it go and seeing what happens. Because many people died in 2020 and 2021 before being vaccinated. They would have been saved had those, let's say, that infection been delayed, pushed into the future. So in a way, time was your most valuable commodity. Can you buy time for medical products to arrive? And so I think that's one thing that hopefully that lesson has been learned. So if something like avian flu starts to spread, governments are thinking about where's the vaccines? Are they stockpiled? How do we get them out? How do we, even if we think flu is so infectious, it's going to spread, how do we at least delay those infections till we can vaccinate more people? So I think that's one big lesson.
Right. No, it's a really important one. I think thinking in future pandemics, for example, what does to pandemic preparedness looks like to you in this moment after all these lessons?
Well, I think it's two parts. One is, and this is where a lot of the emphasis is something called the 100 days challenge,
Yes.
which is 100 days, can we have a diagnostic, a vaccine, or a therapeutic? And rather than it took with COVID a year, 365 days, can we do it in 100 days? So I think there's a lot of efforts being made in platforms, prepping scientific advances, even stockpiling. Avian flu vaccine doses are stockpiled now in Britain. Where I think there's been less emphasis is on what do you do in those 100 days or 150 days? Do you close schools? Do you have a lockdown? What do you do with your health system, with PPE and your healthcare workers to make sure they're protected? So I feel like we've kind of gone full steam ahead in the science, but on the flip side, in terms of the policy side, I don't think we have good answers. So if something like avian flu is spreading, right now we think it could have a mortality rate up to 50%. We can vaccinate everyone within 100 days, amazing. But what do you do for those 100 days with people? Do you say you're locked in your home? Do you say you can't go to school? Do you say the economy shut down? We haven't discussed this. Actually, what does it mean? I think right now we sometimes say no more lockdowns ever again, no more school closures. Part of me is like, it's fine to say that in theory, but if a disease is killing half of people, no one is going to go to school. No one is going to go to work. And so that's why I think we need to have more debates and discussions over the planning, the policy planning. What does it actually mean in that time until we have a medical solution, where so much emphasis is just on the medical solution?
Right. No, it's really important. I mean, there is, well, this 100 days is actually a solid concept that we have to study more and more. And well, for example, SAPI in the United Kingdom is just following this idea. So now, after not having perhaps this ground, it's really important that we all are just understanding that there is strong science and evidence behind this idea of 100 days. But one of the things that when we were reading this book, actually, we also saw one idea, which is around communication of science, right?
Yeah.
So communicating uncertainty, it's actually challenging, right? And based on your experience as trusted public voice and the position that you have now, how should we public health and global health professionals, physicians could communicate uncertainty without losing the public trust?
It's very hard because I face this, that if you say you don't know, people think that you're ignorant, or sometimes you really don't know. And it's better to say, I don't know if you don't know. And in the pandemic with a new disease, there are many things we didn't know. So I think one thing is being confident enough to say, I don't know, but nobody knows. We just don't know. I think also having to communicate that, science evolves and it changes, and the virus changed too. It had mutations. We know that Alpha and Delta and Omicron were all different in terms of compared to the wild type. So I don't know. There's not a great answer, except I can say what I try to do, which is be very honest and say, this is what we know now. This is what we don't know. And then in a future time, if someone asks me, I will say, this is what we know now. And they say, but that's different. And I just have to say, well, it's different because the data is different. Like, what do you do when new data do? Do you change your mind or do you stick? And so I think having to teach almost in a way which is, this is how science is. There are gaps in knowledge, and then we fill them in. And sometimes that knowledge evolves and it changes. And that's what you have to do. Changing your mind is what you do with new data. It's not just sticking in. And actually, some of the people who stuck, and said something in early 2020 and didn't change their minds. I wrote a column on this called "Why Can't People Change Their Minds?" They're still saying the same thing 5 years later. And I'm like, that's not a sign for me of intelligence. That's a sign of me of stubbornness and ego. You have to let your ego go and actually say, I sometimes get things wrong, or I thought that and now it's this. But there's a certain level of having to have like a small ego, humility, and trying to be honest as much as possible on this is what I think and why.
Okay. I really like that message. Thank you so much. And well, changing a little bit from topics, now you're launching your new book, which is How Not to Die Too Soon. I have to say, I love the title of this new book. And the question should be, it's this one. What do you think is the central message you want people to take away from this new book? And perhaps most important, what motivates you to write it right now?
So the central message is that we have the knowledge to know how to live to 100.
Right.
And there are places doing it. What we have gaps in is our policies and our societies creating the environment for us to live that long. So you can take something like blue zones, the idea that there's certain places in the world where people live to 100, and we try to pull out their habits. We say you need to sleep 8 hours, you need to eat a certain diet, and people try to copy this individually, right? They have like, this is my list. The point of my book is the people living in those blue zones don't have a list they tick off. And if you move to a blue zone, you wouldn't have a list. You would just live your life. And in living your life, you would live longer.
Right.
So the real emphasis on the book is, what do we know about us as social beings in terms of we respond to the environment we're in, and how do we make our environments healthier so more of us can live longer? So I look at issues around food and physical activity, smoking, mental health, water, health systems, violence as well. I look at guns and knives to look at actually the things that kill us too soon what we know, and actually the places that where people don't die too soon, and what is the policy environment they're in. The idea being that our living to 100 is less about what we're doing and more about the place we live and the community we're within and how that helps us get to 100. Does that make sense? Yeah, in terms of the approach.
Right. Basically, it's also the importance of changing the environment, changing the lives in that environment, right?
Exactly. Yeah.
Lovely. And I think if I'm not mistaken, there is a new blue zone in under construction, perhaps in the development in Florida, right?
Yeah, I mean, I guess the idea being that we try to create these longevity communities where
Yes,
people can live, but my thing is actually we should make more of the places look like this. How do we get more places in the world
of course.
to look like blue zones? What are the lessons in terms of policy measures to make places healthier to live in so that you don't have to actively think about your health? You just live your life, and in living your life, you are healthier.
Of course. So this book's already available on Amazon and for global purchase, right?
Yeah, you can get it on Amazon, libraries, e-readers. And I'm really keen for people to kind of engage with it just to challenge their view over it's kind of a pushback to the self-help, gratitude journal, just think yourself healthy literature
Right.
to say, let's think about things a bit more deeply. So it's a challenge to that people read it and think at the end, do I agree with her? Do I disagree with her? Do I partly agree with her? So
Lovely. Thank you. Thank you so much. Doctor, one last question, and perhaps for me, this is the most important one. It's a question that we always ask the guests that share with us these ideas in these conversations. As you may know, many of the listeners are students and young health professionals that are just starting their careers in public health. If you could share one key message with all the students and healthcare professionals that are listening now, what message would you like to give them today?
I think it'd be the message of progress and hope that actually things are getting better in public health, but keeping the fight going because we will go backwards if we don't continue to invest in health, prioritize health, and make sure that politicians take this seriously. So in a sense, to kind of keep going, stay passionate, stay true to your values, and that, yes, sometimes you can feel cynical and think nothing's changing, but actually the real message as well of my latest book is how much has changed, how much progress we can make. But we have to stay focused on moving forward. So that would be my thing, a message of kind of hope, progress, and staying passionate and motivated.
Lovely. Thank you. Thank you so much, Professor. Professor, well, thank you. Thank you very for sharing your time and all the insights with us today. It's really a privilege to have a conversation with you and all the perspectives that you have on health governance of the pandemic, prepararnos with all this experience, and in particular with communicating science, which is quite challenging for many of us, actually. We really appreciate all your contributions. And again, from the Mexican Society of Public Health, thank you for the time and thank you for the opportunity to have this conversation with you.
Oh, well, thank you, Louise, and all the best. And I look forward to, hearing any feedback anyone who sees this video has or any feedback on the book. So thank you very much.